Hi, my name is Dave Malley, and I practice at Advanced Urology here in Atlanta, Georgia. So I grew up in Pittsburgh, Pennsylvania. I went to elementary school in Pittsburgh. I did move to Detroit, Michigan for middle school, came back to Pittsburgh for a high school and stayed there. So I went to medical school in Philadelphia, and then I moved to Pittsburgh, to University of Pittsburgh Medical Center, where I did my general surgery as well as my urology training. And then I moved to Manhattan. I went to Memorial Sloan Kettering Cancer Center, and I did my urologic oncology fellowship there. So I chose urology mainly because of the variety of cases that I get to do. So one day maybe removing someone's bladder for bladder cancer, and then I'll build them a new bladder using their own intestines, which is awesome, a great surgery, very rewarding. The next day, it may be treating someone with kidney stones. They come in a lot of pain, and we treat them endoscopically, no surgery whatsoever, no incisions, and they go home and they're very happy and they're doing much better. And some other simpler things that you can just treat with medications, but it's great, rewarding, exciting, and you're never bored. So I'm a urologic oncologist, and as such, my fellowship training is in treating cancer. And I love that. Every week, I'm usually removing several organs for cancer, and it's really rewarding to give someone, tell them that you're cancer-free. And I knew I'd love that, and that's absolutely very exciting. What I didn't realize I would love until I started practice was treating some of these other conditions which are not as sexy, but have a tremendous impact on someone's life. Something like someone constantly going to the bathroom, an overactive bladder syndrome. I once had a patient who, one of my first patients that I treated with an overactive bladder, and I put an InnerStim device in her, and when I saw her afterwards, she was crying, she was so happy. And she was happy mainly because it changed her life. I didn't realize until I put myself in her shoes, listening to her response, the impact that I made on her life. She was telling me she was constantly going to the bathroom, she would avoid hanging out with friends, she would wear dark clothes. She was afraid that they could smell the urine on her. She wasn't getting much sleep because she's constantly waking up to go to the bathroom at night. It had such a tremendous impact on her life, and now she's going back to normal. And that's when I realized there's so many awesome things that we can do in urology. And as a result, I started to focus a lot more on treating overactive bladder. In fact, I'm one of the very first centers of excellence for InnerStim with Medtronic. And I treat many other conditions now, Center of Excellence for treating BPH with UroLift. So it's one of those things that I've realized treating these functional outcomes, it has a huge impact on someone's life until you empathize and you put yourself in their shoes and you see what they go through and you make that difference. And when you see how they're doing afterwards, that really makes you happy. So what I want my patients to know is that the way I think of medicine is my job is to educate the patient on the options they have, the pros, the cons. That way they're an informed decision maker, making their own decisions. My job is to give them that information. And then when they want to do something, I want to give them the best possible result technically as well. What I want my patients to know is that I think it's an honor to practice medicine. And in that sense, anytime someone comes to see me, I want to make sure I do my absolute best to give them the best result.